I'm Alyssa Shagru, the policy coordinator for NAMI Texas, and I stand in support of this bill. But I just want to emphasize a lot of the things that appear in this bill around training and support and school-based mental health services, like allowing them and education, are what shows up in a lot of best practice frameworks. So the National Center for School-Based Mental Health at the University of Maryland has a framework of community-partnered school behavioral health model that really provides that framework of how to effectively do school-based mental health services. And on this document, I'll show you kind of going around administrative support, sharing space, working with community partners, social and emotional learning education. This bill, touches on a lot of those areas of how to effectively do school-based mental health services. So, anything around here is kind of what will get us moving on this issue.
Again, my name is Alice Lenahan, and I am against the bill, and I am speaking as a mother and also as with Women on the Wall. And a view from the classroom of today would astound onlookers that mental health and social, emotional, and behavioral interventions have replaced academics. With these wraparound mental health services and interventions into personalities, values, beliefs, and dispositions at school, teachers are expected and forced to monitor and collect behavioral data on our children that has nothing to do with education. Data is collected, logged into state longitudinal data systems, shared, and ultimately exposes our children to surveillance capitalism. This personal data is freely given and used by outside contractors, foundations, and businesses to create software, curricula, activities, and programs that delve into changing the personal qualities of our children, their families, according to government set objectives and outcomes. And I gave you all a longer letter. I won't sit and read the whole thing.
We appreciate you not doing that. Thank you.
Yes, but there are some real violations that we believe not only this bill does, but ESSA that is being mandated on you from the federal government.
Mrs. Linehan, we're going to stick with House Bill before us, please.
Right,
Thank
but
you.
Because this bill implements ESSA, and I'll just read through a couple of these, the violations of the medicalization of our schools. One is the data collection. Number two, data trafficking, and we've already experienced that here in Texas with SpedX, a no-bid contract where student data was given to a third-party contractor, and that data still has not been accounted for, even though the contract with SpedX has been done away with. The treatment, interventions, and psychological social emotional learning that's being done, this character training, is actually a violation. It's being done in the classroom.
Mrs. Linehan, is that a part of House Bill 18 that you're talking about?
Yes, according to the
what
other.
What page are you on and what line of the bill?
I'm not looking at the bill, I'm looking at my
Someone
testimony.
give her a copy of the bill so we can follow you.
Okay, well, what
Now,
I'm
we want
saying.
you to point it out so we can follow you because we like to follow you on this bill.
Okay,
You say
what
you're
were
speaking
saying
about the bill.
earlier testimony and what
We only on House Bill
Representative
18.
Forbright.
We only on House Bill 18. Our
Correct.
record is on House Bill 18. We are recording this testimony on
Yes,
House
ma'am.
Bill 18. And I don't want to trip you up,
According
and I don't want you to
to
trip
what
the evidence up here.
Representative Price stated before and what I've heard testified, the people who are for this bill, the interventions, the social emotional learning, the mental health interventions that are being done, I'm not talking about acute mental health, I'm talking about just the social emotional character interventions. That is being done without parental consent. When you shift away from academics to the behavioral and character training, who decides that? As a parent, that's my role. Attitudes, values, beliefs, and behaviors are the right of the parents. And if you are putting in place programs, best practices for social emotional learning, you're violating my parental consent. So So that's why we're against the bill, and because the statewide longitudinal database system is collecting this data, and because the FERPA law was gutted basically in 2012 to say that our children's data can be collected without consent in the name of research, and then they passed WIOA, which impacts this bill because you've got federal dollars coming in through Health and Human Services, through different agencies, and then in 2019, the Foundations for Evidence-Based Policymaking Act was passed, which makes legal the interoperability of all of these agency databases. So if my child is seen as having emotional issues and that is put on their record, that will follow them for the rest of their lives. That's not the role. I don't send my children to school. I didn't send my children to school to be psychologically analyzed and to be tracked by the state or the federal government for workforce purposes, for whatever. So we're diving into an area that will have implications on our children for the rest of their lives.
Thank you, ma'am.
Yeah, for Mr. Spiller,
Yes, sir.
You mentioned the mental health screenings, because I think I'm trying to figure out where in the bill there
It's
are
not
mental-
specifically in the bill, and I'm
There are
sorry if
mental-
that misled you. Obviously, we're headed into integrating more services in, but it is not in this.
Right, I think in the future, and I think that I think you are right, and I am concerned with where we're heading on the mental health stuff. I make no secret about that. I think it's important that we address issues, but I also think it matters how we do it a lot. But I just also want to make sure sometimes we're talking about what's actually in the bill, sometimes we're talking about other stuff that has nothing to do with the bill. Sometimes they are interconnected.
Yeah, I slid off of that.
No,
Yeah,
that's all right. That's all right. I just want to make sure, because I think Chairman Price rightfully said that requires parental consent.
Correct.
I think the flip side is there was a very good point made, and I don't want to. It's not really a question, more of a comment, but I think I understood a little bit. When we start training on certain things that are not academic, you are stepping into parental. You're not doing academics now. You're doing mental health. You're not getting permission because you're not doing a screening.
Correct.
But if by definition you turn it and you all of a sudden start talking about, and the last thing, and she'll stop me if I'm going too much, I also, from the testimony, I am concerned. There's a huge industry in this, and we are kidding ourselves and that's not really in the bill, but we're kidding ourselves that that's not part of the issue, that we all need to be careful as we delve into it.
Right.
So.